So with respect to robotic surgery versus the traditional open approach, the main advantage is the minimally invasive technology, giving us better outcomes with respect to much less bleeding, intraoperatively, less cardiovascular problems, less wound infections post-operatively, and earlier discharge from hospital, and less early pain in the post-operative period, particularly for the first 1 to 4 weeks. The actual outcome of prostate cancer surgery depends on the surgeon more than the robot, because the robot just replicates what the surgeon tells it to do. The main aim of the robot is to increase the visualisation, so we have a 10 times magnification compared with our normal eyes. It's a 3-dimensional view inside the robot console. And the arms, unlike laparoscopic surgery, which are fixed and straight, they're reticulated, so the movement of the robot does the same thing as the movement of my arms in the console. Well, the main advantage of the robot, it's been able to give us firstly magnified view, and secondly, we're operating with keyhole type surgery. So instead of putting my 2 big hands inside a man's abdomen and removing the prostate, we put little instruments into the abdomen. Wesley Hospital is the only hospital in Australia that are a robotic centre of excellence, which is essentially an internationally recognised commitment to robotic surgery and obtaining the best outcomes after robotic surgery that are possible. And it reflects the surgeons that attend the hospital, and they're all dedicated to getting good outcome, less complications, and we're proud of that achievement from the Wesley Hospital.
Care to Share, brought to you by the Wesley Hospital, because your health matters.